Well, history was made in Tahlequah this week as ground was broken for what will be the first tribally affiliated medical school on tribal land in the United States. A school built on the premise of improving health outcomes in rural Oklahoma.
I'm tickled to share this great day in the Cherokee Nation with each and every one of you. And I agree, this will change the lives of our people for the next 7 generations.
Principal Chief Bill John Baker is doing something that's never been tried before, partnering with the OSU College of Osteopathic Medicine to build an 80,000 square foot medical school on the W.W. Hastings campus in Tahlequah.
How we train our medical students is important, and it has an impact on where they practice. And so starting right here in Tahlequah, Oklahoma, spending their 4 years training here within tribal health systems within rural Oklahoma will help us to ensure that we're placing those doctors in the most needed locations across our state.
The school is scheduled to open in August of 2020 and initially enroll 50 students and up to 200 potential new doctors when it is fully operational. A new generation of physicians that are desperately needed in a state that currently ranks 46th in the nation in the number of doctors per 100,000 people.
I attended undergrad here at Northeastern State and I enjoyed my time here, so the opportunity to get to come back to this community and potentially work as a physician and train next to physicians is it's exciting to me. I would love to be back in the area. I have a special place in my heart for Tahlequah.
The $40 million facility will be built within a few hundred yards of the soon-to-be completed Hastings Clinic, allowing students to learn in state-of-the-art facilities and then walk a short distance to complete the rotations in a $200 million state-of-the-art outpatient clinic.
Would you ever have thought in Tahlequah, Oklahoma, we would have a 469,000 square foot clinic that could be in the middle of Dallas or Tulsa or Chicago or any place in the world? And we've got it right here in rural Oklahoma that will literally take care of hundreds of thousands of patients.
I've had many family stories where, and I've heard many other stories very similar to mine, where people can't get the help that they need. It's either too far away, it's either too expensive.
Mason Tucrow is determined to change that. He is a full-blooded American Indian entering his second year of medical school at OSU, and the first member of his family afforded the opportunity to pursue a dream of becoming a doctor.
This school and this partnership will help motivate students to realize that they can do it too. And that's one thing that I want the most, is for more Native doctors, more doctors in general is fine by me, but more inspired Native youth. I think that's the real accomplishment here.
The school's enrollment will include non-Native American students and Native Americans from tribes other than the Cherokee. But Chief Baker envisions a special role and benefit for his people.
I think it's important that we grow our own. I think that our people, if given the choice, prefer to be treated by family, because that's what we are. If you're Cherokee, we're related. We're cousins. We're family of some sort.
The health clinic will be open to any member of a federally recognized American Indian tribe, and staffing the large facility will be a challenge made easier by this partnership with OSU. Not only is there a critical shortage of doctors in rural areas, but the ones that do exist aren't getting any younger. According to a 2017 United Health Ranking study, 55% of rural physicians are older than 55.
The partnership really came about through a shared vision, Chief Baker's vision to improve access and health outcomes for the Cherokee people, and our commitment to improving rural health and focus on underserved. And so from that shared vision, this tremendous partnership came about.
The construction costs are being covered by the Cherokee Nation, which will then lease the facility on a long-term basis to OSU.
We're going to honor our ancestors. We're going to grow our own physicians right here in Indian country at W.W. Hastings in Tahlequah, Oklahoma, with a partnership with OSU.